Hi everyone, happy, where are we? Wednesday. I hope you're all well. Thank you so much for joining our Beauty Triangle Instagram Live tonight. It's going to be a really interesting conversation. It's very much a continuation of everything that we have been speaking about this month, which is all to do with women's wellness. And I'm really excited to be joined by the incredible Dr. Selena Langdon. She is the founder of Berkshire Aesthetics, which is a gorgeous clinic out in, as the name suggests, Berkshire. She offers so many different treatments under one roof, but actually tonight she's going to be telling us about the devices and the technology and the modalities that can really help us to manage that transition from midlife through menopause. And whether that's physical, emotional, hormonal, she is a lady with a solution for everything. So I think she is just joining us now. If you do have any questions for Selena, please just put them in the comments box at the bottom and we will come back to you as soon as we can. And here she is.
Hello, Francesca. How are you?
I'm really good. Thank you for joining us. How have you been?
Just a really busy day, very tired. It's quite nice when it's this time of the evening and it's almost over. So yeah, I'm glad it's almost the end of the day now.
Oh, 100%. Well, I've done a little bit of an introduction to you already. However, I'd love to get your perspective. Obviously, for October, we've really been discussing women's wellness, everything from menopause to the treatments that can help us in midlife, aesthetically, emotionally. I'd love to get your thoughts. I mean, what percentage of your patients would you say are menopausal or perimenopausal?
A really large percentage, actually. I think it's just, I don't know whether it's just our demographic. Naturally, we've got a lot of patients in that sort of age group that come to see us. I don't know if that was because it's just grown organically, but for one reason or another, we tend to have that sort of either perimenopausal or menopausal patient that comes to the clinic for various reasons. I don't tend to see a really young demographic. It could be, or actual geographical location possibly, but it's become a huge part of what we do here. And even if a patient is coming to you, possibly not even necessarily for something that they realised was sort of related to for a menopausal reason as such. 9 times out of 10, it turns out that has a lot to do with it. And actually, it's become really important for us to kind of understand that as an overall process. And so we've incorporated a lot more women's health into the practice now.
You're so right, actually understanding where menopause, perimenopause fits in. And I think also not just seeing it as an isolated chapter in a woman's life, but just as a continuation. And we've spoken a lot about this month, about actually trying to celebrate this chapter of life, which seems like such an alien concept when it is a subject and a time of life that seems to be so stigmatized and that sort of is surrounded by so much negativity. What do you see in the patients that come in to see you? Are they complaining of menopausal symptoms? And if so, which are the most common?
Yes, I mean, for sure. I think there's a lot of, it's just not openly discussed enough. And I think a lot of women will come because they have issues and concerns and they don't really know what to do about them. So they feel a little bit lost. They're looking for some sort of guidance. And I think I've just begun to appreciate that actually, if you can kind of discuss very openly the sort of symptoms they're experiencing, particularly when it comes to things like incontinence, which a lot of women are very nervous about discussing with a doctor, let alone with anybody else. I think it's become sort of much better for us now to be very open about it. But yeah, definitely for sure. I think we're seeing now the conversation is happening and it's becoming more and more, discussed even in the workplace. I was speaking to a patient a couple of weeks ago and she said they have a menopause awareness day now at work to try and help other staff members to understand that you can go through such significant changes emotionally, physically, in every which way. And actually, it's important to appreciate that it can be life-changing. And
that's so important as well to integrate it into the workplace because there's been so much sort of literature on menopause recently, and I think the stat that I keep reading is that 1 in 4 women actively consider or actively do leave the workplace because they feel that they cannot manage their menopausal symptoms. And that's such a crime, against women that at the peak of our lives almost, when we're achieving so much, when we're so in control and so confident in all other areas, that it should be something that is a natural transition in a woman's life that prevents her from living life to the fullest.
I mean, even speaking to another patient the other day who is one of the only women, particularly of her age group, in her working environment. She's in a very male-dominated sector. And a lot of the men that she works with didn't know what menopause was at all. And I think not that that is the fault of any of the men there. It's just, it's something it's women's troubles. We don't talk about it, sort of thing.
Exactly.
But actually, there needs to be a dialogue. I think it's been fantastic that you've had the likes of Libby McCall, do a television program about it to actually put it out there. And actually, it's changing a lot, even within the NHS. They are discussing it a lot more. There's a lot more material that's being handed over to GPs so that they can discuss it more openly and more freely, because it's not just about HRT. There's a lot of other aspects that need to be addressed.
Absolutely.
Changes so many things in the body, and can make some women feel like they're going mad.
Yeah, 100%. And as soon as we lose that sense of control and identity and who we are, we lose perspective, and it's really easy for these what might on the surface seem like sort of tiny little physical symptoms actually to become something that really does rule our lives. And you mentioned incontinence earlier, and I've heard so many stories of women who really do battle with it. It might be sort of exacerbated by childbirth. It might just be those hormonal changes, but to have your life governed by when and where you can go to the loo and live in fear of that is not a way that we ought to be living our lives in this day and age.
It is. I feel so strongly about this, actually, because I don't know, I've always said that I really hate the sort of tenor lady type adverts and things like that, because we've almost normalized incontinence as though it's something that we have to accept, that it's okay. It's not okay. Actually, it's it has a huge challenge I had one of my very first patients that we treated from an incontinence side of things quite a few years ago now. She would flood, and it would really upset her because she couldn't go anywhere. She was always worried about where the next toilet would be, taking spare underwear, pads. And that completely controls every aspect of your life, that you just can't enjoy anything. And it shouldn't be like that. We should be addressing it early on. There should be more information out there to explain that there are lots of treatments. They're not, terribly aggressive or, overly invasive, and actually have a huge impact and improve your quality of life. And that should be a good thing. And actually, it should be discussed like that, rather than hidden away and made to feel as though it's taboo and we can't talk about it.
And you're so right, it does come down to quality of life. And I feel like we've seen such an explosion of devices in the world that you exist in aesthetics and cosmetics, that actually there might be an aesthetic benefit as well, but actually there's such huge functional gain. And incontinence is obviously a huge one. You've got all sorts of devices, haven't you, that can obviously treat incontinence or sort of even emerging bladder weakness.
Definitely. I mean, we started off with UltraFem, which has been a long-standing treatment in the clinic, and I actually then sort of migrated also to introduce Mcella. They are both very competent systems when it comes to treating feminine health, but they work slightly differently. The UltraFem is designed, it's a vaginal probe, it's designed more to target vaginal health, the actual strength of the vaginal canal, lubrication, sensitivity. It did do a very good job at treating incontinence as well. And actually, we do often combine them. If some patients have a little bit of a dual issue, sometimes it works well together.
Yeah, which is that radio frequency that it uses?
Yes, so it's monopolar radio frequency. It's delivered where the probe actually has radio frequency emitted from all the way around, sort of 360 degrees.
Wow.
So it just means that you're being very cautious. You're just treating the wall of the canal, which is much safer. It gives tissue tightening, and that overall can, just improve quality of life from that side of things. And
relationships as well, like sexual confidence. I think that again must be something that is a real factor in sort of life changing and breaking down. If you can't enjoy sex with your partner for various reasons, that being one of them, then that's only going to enhance everything else that's going on.
one of the things I will always ask patients after they've had ultrafem is how was sex afterwards? And actually that's one of the number one sort of telltale signs of whether it's improved. If their partner notices a big difference, they're always so happy when that's, you know, taken place, because again, it's sort of, I think there's that feeling of, oh, you know, I might be letting my partner down, or it's my fault that this, you know, doesn't feel the way it should do. And that's always really satisfying to hear a patient turn around and say, actually, that's massively improved now, and I'm really happy with that. But at the same time, then, you know, again, if a woman is suffering with incontinence, in addition to all of this, we have M-Stella, which is electromagnetic technology. So it's using like a magnetic field, if you like, to cause lots of contractions for the pelvic floor, and it will be able to perform a lot of pelvic floor exercises that you and I couldn't do naturally, that number in that space of time.
Yeah, how many does it, what's the equivalent?
I want to say, I'm sure it's something like 28,000 in like half an hour. So it's an absolutely ridiculous number.
Yeah, no way would you or I manage that.
But you know, you can feel after I've tried the treatment myself a couple of times to see what it feels like.
Yeah,
it's such an unusual thing to sit
it's
on.
very intense because it's a chair, isn't it? It's a very big circular flat chair. It obviously looks very sort of, you know, slick, white, clean, ergonomic, but you do just sit on there fully clothed.
Yes.
So it's non-embarrassing in every sense of the word, and it sort of just emits these like vibrations, I suppose, that sort of travel through your body.
Yeah, it is. There's a key to making sure you're aligned on it in exactly the right position, because you'll be able to tell the minute your pelvic floor engages with it. And obviously you can change the intensity depending on how much you can tolerate. You know, some patients can't tolerate really high settings, and that's totally fine. You can work your way up to that.
I guess it's very bespoke to the patient, isn't it, and what their anatomy is like.
Precisely. Had they had a hysterectomy? Have they had surgery? Have they recently had a baby? Those sorts of things.
Yeah, exactly.
You could cater it for that individual, and a lot will see improvements even after just 3 treatments, which is, you know, really impressive, and can massively change how they feel about themselves, not worrying about, you know, the little accidents that can happen if you have a cough or you go to the gym. You know, all of those sorts of simple things.
And how many sessions is the course of BTL M-Stella? Because it's not a one-off, is it?
It's usually 6. So it's normally 6, couple of week, 2 a week for 3 weeks. And it's slightly different with ultrafem. It's normally 1 a week for 3 weeks.
And that's really nice, actually, because often the treatments that we talk about are sort of spaced over such a long period of time, or it takes so many months to see a result. But actually, it sounds like the results of the ultrafem or the M-Stella are actually fairly, you know, noticeable, right, from the offset. I
do usually just a 6-week follow-up appointment, which is not that long from the course of treatment. And all my patients tend to turn around and say, actually, I've noticed a significant difference. And then it will obviously continue to improve as well. But that's always great feedback. I have to say, they are 2 of the machines in the clinic that always give a good outcome. I feel as though never let me down, and every patient's been really satisfied when they've had treatment.
Yeah, and it's funny because I very much think of you as a body expert, which obviously applies to all parts of the body, but you also won like the prize, didn't you, for like treating the most vaginas in the UK or something with this technology, which I love.
I always think it's such a strange thing to be awarded, and I had no idea it was going to happen. And I'm being contacted by the company because I just happened to have done more than anybody else in the UK at that time. But it was really interesting. I don't know, there was just a really huge surge in inquiries during COVID. And I don't know
what's interesting.
This was during the sort of pandemic time. And when we came back after lockdown, I was just doing lots and lots of vaginal treatments, and it was good.
But I wonder what caused that. I mean, do you think it's the general, I mean, we've heard that lockdown COVID sort of caused, you know, so many stress related, you know, whether it's skin flare-ups, whether it's hormonal imbalance. I mean, is there any link to, you know, that enhanced stress sort of triggering incontinence or these issues?
It could well have been, or just, I really think that during that time, so many of us became so aware of our bodies and what
that's so true
with them, because we just had more time to think and kind of reassess things. And I think it just kind of made women feel a little bit more empowered to address it and sort something out that was bothering them. And it was, as with a lot of the other procedures that we do in the clinic, there was such a huge interest when we reopened. I think people had more time to research as well. So they went away and did a lot of reading around these treatments, and then decided, you know what, I'm going to sort this out now. I've been putting it off and I need to get it fixed.
So true.
I think it was just more awareness.
Do you actually actively get women coming in to see you and what they want to discuss is things like vaginal health or incontinence, or does it come about as a result of they're there to talk about some body contouring or some fat loss or some skin tightening, and then it comes up eventually?
No, I mean, we do. We get a lot of people that just solely inquire for that purpose, because whether or not we've just become a little bit more known for women's health potentially, and they're getting in touch with us directly for that reason. But we take a very holistic approach. Even I had a patient in this morning. She was coming in to discuss injectable treatments, but actually, when we have a medical form that they have to fill in usually, and we take a women's health history for every female patient that comes into the clinic. And part of that form discusses those sorts of symptoms. And I noticed that she ticked the box for stress incontinence. So we then just naturally had that conversation. And actually, she'd already been a little bit interested in Msella, but she didn't feel like she was supposed to talk about it in that appointment. But I said, no, we're supposed to check everything, really. Right. So I think it's helped that we sort of take a very holistic approach. And I think because we've kind of placed women's health fairly high up in terms of importance, it's become very easy to discuss these things. And actually, funnily enough, we have a video running of the Msella treatment just on the screen in the waiting room, and it raises so many questions, and so many women come in and say, oh my God, what is that machine? What does it do? And I think that opens a conversation, and it really helps to kind of
I often see when I go into clinics and I go to the loo, leaflets, for instance, or a notice for the Msella chair in there. And again, it's catching women when they're feeling like they're in an environment where they can be open-minded and they feel safe enough to sort of have these conversations. What about other areas of the body? I mean, we often talk with menopausal patients about the sort of hormonal belt, with weight gain, and that's obviously a notoriously tricky area to then control sort of weight gain, isn't it? Sort of when you hit perimenopause or menopause.
It is, and it's because so much changes. I think your body becomes that little bit more resistant to diet and exercise, and actually hormonally. That I think fat behaves very differently. I find we do a lot of body contouring treatments, and I do find that any of my patients that sit in that perimenopausal or postmenopausal category, they do have a difference in terms of how well they respond to treatment. And it can be a little bit more stubborn. So I find that we end up having to do slightly different treatments or combination treatments to try and get to the sort of same level of result. But it's just about modifying what we do so that we can address that particular individual. Skin laxity becomes such a bigger issue, I think, we lose collagen as we age and as we hit menopause. And actually, if you don't address that, very often results don't look quite as good. And, it's an important it's an important concept that we have to take on board, that if you don't address skin, muscle, fat, you can treat a tummy, and it won't look that great if you're just addressing one of those three. But if you target all three, it will look far better.
And is that the order of service you're doing it in? So muscle, fat, skin, or which order did you say?
Definitely skin first, because if first into the right place, it makes all the other treatments so much easier. The tricky thing is with some of the body contouring treatments, you can be left with a little bit of skin laxity, because if you do remove fat, the skin doesn't always catch up as quickly, and it's a little bit more sluggish when you are in that sort of postmenopausal category. So I always tend to address the skin, get it in the right place. I then tend to remove fat because it feels like it's a natural progression to that. And then I will also address muscle laxity if there is a degree of that, because again, from an old, C-section or, babies that were delivered 20 years ago, there can still be that laxity in the abdominal wall. And if it doesn't get included in the treatment, sometimes you can kind of miss a little bit and it doesn't look quite right.
And that diastasis recti, where the muscle split, that can almost exacerbate the feeling of additional width and sort of girth around the midsection, can't it? Even when, a woman might be tiny elsewhere, if those muscles haven't sewn back into the right position, then that can, obviously sort of cause all feelings of, I can't lose the weight from the middle. And actually it's the muscles, like you say.
Definitely. I've found that if that part isn't addressed, sometimes even if you're removing all of that fat, it still almost looks like a little pot belly, if you like.
Yeah, exactly.
And it aesthetically or cosmetically, it just doesn't quite give that, really nice result. So I always have that very honest conversation with the patient and say, I'd love it if one machine did absolutely everything, but it doesn't. And so I have different machines and different modalities of treatment to try and address that. And M-Sculpt is a fantastic treatment for tightening up the muscle. It can be very good in certain cases of diastasis. Obviously, if they're very big diastasis, surgery is unfortunately the only option there. And I have a lovely surgeon that I do refer patients to. But if they've got, a small diastasis and they look suitable for treatment, then M-Sculpt can do, really great, give them a great result.
And it's the same technology, isn't it, as the M-Zeller? It's the magnetic muscle induction, yeah.
It is. And it's been fantastic for us because I think we actually get more inquiries for that than we do for somebody looking for a traditional type of six-pack type result or something like that. So it's actually become a bigger treatment for us from that side of things. So
and that actually just goes to show that this trend, towards quality of life is not going anywhere. Functional gain, I think, particularly after lockdown and COVID, we suddenly have this whole newfound appreciation of our health. And therefore, actually, a treatment that can deliver the aesthetic and the quality of life functional improvement is only ever going to be a good thing, isn't it?
Definitely. I mean, I think people they're more aware of treatments, and actually we're in a very fortunate position that I think the taboo around these procedures has started to fade, and people are actually more accepting of approaching a clinic, having treatments, taking ownership of wanting to do something. Again, another patient that I had this morning, she's had a lot of life stresses, quite a few bereavements, and she's just said, you know what, I've hit 55 and I want to sort this out now. I want to look after me and I want to feel better about things, and I've decided this is what I'm going to do. I have a lot that present for mons pubis treatment, because that again is something else that a lot of women, especially either perimenopausal or postmenopausal, will start noticing. You can get more fat development and fat gain in that area. And a lot feel, that.
And that's around the sort of bikini line area, like where a cesarean scar might go, almost your nipple line.
Yes. And it can look quite bulky at times. And I think a lot of women feel that it makes them look less feminine. And, very conscious if you were to wear a pair of leggings or, want to go and do yoga that day, and they feel embarrassed, or going swimming or something. And actually, again, the discussion's not really had very frequently about treating that area. There are some fantastic treatments. We do a lot of cool sculpting, and
it's so localized, so it's but what's causing that excess? Is it excess skin? Is it skin laxity? Is it sort of the dropping of volume from elsewhere?
I think we sort of almost, as we come to that, as we were talking about that sort of hormonal belt that kind of appears, it's really common for there to be almost like a little bit of a dip, and then the mound of the mons pubis looks more exaggerated. And it's almost as if, because it's a very separate area, very well-defined pocket of fat, and it just can start to enlarge and bulge. And again, hormonally, depending on what sort of phase you're in, with regards to menopause, it can just enlarge and look more obvious. And so actually it is just still fat, and it can be treated, but care has to be taken because it's a very sensitive area to treat, and you just have to be very cautious, because the one thing you don't want to do is leave the patient with more skin laxity there.
Exactly.
Take care.
And it must be a very small applicator that you then have to use for that.
It is. There is, and luckily there are several very small ones that fit almost perfectly on a lot of patients. Actually, it's a very size, but you have to be cautious. There's lots of important structures in the groin area, and you just have to be very careful that you avoid them and you don't cause any injuries there.
No, it's brilliant, and actually I think it's wonderful actually to have a doctor such as yourself who is female, who understands that issue that the female patient might be going through as well, but also to have somebody such as yourself doing a treatment like cool sculpting. Not every doctor does it, and I think particularly when you're addressing these areas that are anatomically complex but also have a lot of emotional connotations, it's important to see the right person.
Definitely. I mean, I think that's one of the nice things that I have in terms of relationships with my patients, is that they trust me to do a treatment on them they feel incredibly insecure about. Probably wouldn't necessarily just go to anybody to discuss it, they feel open and confident enough to be able to say to me, actually, this is something that I would really like to address. I'm quite embarrassed about it, but I do want to do something about it. And I've been having some really lovely, very impressive results with it. And I think that's given me that confidence that actually this is certainly something that, I was told off by a patient for not talking about it and not mentioning that I did the treatment, because she felt that I didn't make enough people aware of it. And so we started to talk about it a lot more.
That's a really valid point, actually, because if the patient isn't going to bring that issue to your door, then actually and I know you have to be very careful as a practitioner. You can't point out things that you think the patient should do. So it's very much in your sort of softly approach, isn't it? But I think you are right, educating patients about what is available, because so many consumers don't know that all of these fantastic treatments exist. And as you say, they have an enormous capacity for change and quality of life.
Definitely. And I'm glad it's something that we do talk about a lot more now. And it's brought, again, a huge amount of interest for something that I didn't even think would be very popular. And actually it's become a very popular procedure for us because it's very effective. And I feel as though it's made a lot of women feel much happier about their bodies, given them a lot more confidence. And, just address something that we were just completely ignoring.
Yeah, I totally agree. And I mean, that's all good and well for the sort of very precise, small little areas. You mentioned cool sculpting. That's obviously great for localized areas of fat that we can't shift. What about if somebody is generally struggling with sort of holistic global weight gain? Is there anything does that come down to just lifestyle choices, or are there treatments that can at least, kickstart their sort of healthier, sort of lifestyle?
Definitely. I mean, obviously lifestyle is extremely important. Diet, exercise, changing your diet quite a lot, probably postmenopausally, does have a big impact, because as much as we'd all love to be able to eat exactly the same way we did when we were teenagers or much younger, our bodies hold on to food in a slightly different way as we age. And it does become that little bit tougher. And actually weight gain can very often become much easier as we get older. And so I think if a patient isn't willing to sort of address those factors, it does obviously have implications, because again, I don't have a magic wand that can just do everything. There's always a bit of a partnership. I like to hear that they're, making sure they're being healthy, exercising, it doesn't have to be extreme, but just, being motivated to do all of that.
Exactly.
We do have a lot of patients that again will say to us, I feel like I just need something to just boost me a little bit. It's not quite, getting to where I need to be, and whatever I'm doing, it's still not quite working. Aside from cool sculpting, we also have Vanquish, which is another treatment, which is from the same company that manufactures Emcella and Emsculpt, and that uses radiofrequency again, but it's slightly different. It's better for sort of overall circumferential loss around the abdomen. It can only really treat this sort of abdominal area, the thigh area, but it can give good sort of overall debulking and loss of, volume. And
then
actually
the one where you lie on the treatment bed and it's almost like the lamps are sort of arranged over you.
Yes, that's right. It's been around for, as long as cool sculpting. It's not a new technology. It's been on the market for a while. It's really popular in the US, but I don't know, it never really quite got to the sort of level of, popularity here in the UK. But because I've had cool sculpting for a long time, I felt there was a little market of patients that I hadn't quite had a treatment that was effective for them, because I was turning them away for cool sculpting. I thought, you know what, there's something that I'm not quite doing here. There's a gap. And actually, it's fantastic for that sort of abdominal treatment. And it really does. It helps to kickstart and improve that sort of fat loss, but it's also very good for skin because it's radio frequency. It causes quite a lot of tissue tightening as well. So I feel as though having the combination of the two just means they call it fire and ice in the States quite a lot, because they do this treatment where you get a lot of debulking and skin improvement, and then you can go to cool sculpting more for a sculpted appearance.
Oh, I see. So you use the two in tandem. So first, because I have had Vanquish, like you say, years ago, actually, and it's an interesting sensation, because you first think, oh, this is quite nice. I'm just lying on a bed and it's pleasantly warm, and it gets hotter and hotter and hotter and hotter. But then suddenly it switches off and it's cool again.
Yeah,
that's right. Yeah,
it is. It's a very strange sensation. You feel like you're under the machine, sweating nose, and it's an unusual feeling, but it's called tuning. It's trying to deliver that radio frequency in a very even arc, So it's very good at sort of, it can penetrate a decent depth. And so you tend to do 4 treatments. They're normally sort of spaced out sort of 1 a week. But you may do potentially back-to-back courses. So you can do sort of up to 8, depending on the amount of fat that you want to remove. But it's very comfortable. It's not an extremely painful procedure.
Yeah, no, I would agree. It's, cool sculpting feels a little bit alien, because it's sort of like these icy applicators that sort of like hoover your fat up. Whereas the Vanquish, you definitely just lie there, and if you can just sort of deal with the hot cold element. Of
course, yeah. I think if somebody who's a little bit more pain sensitive, Vanquish is a slightly easier treatment to tolerate. But as I said, they work in tandem really well with each other, because I find that there's definitely a very suitable Vanquish patient and a typical patient that's suitable for cool sculpting. So it kind of feels as though I've now got several options, and I can at least give patients more opportunities to pick.
And more to the point as well, for menopausal patients, and perimenopausal, you also offer BHRT as well, don't you? There are bioidentical hormones going on in the clinic.
Yes, yeah, no, definitely. It was, again, a lot of patients contacting us saying, why are you not doing this? Why do you not have this available in your clinic? You do a lot of other women's health, but they felt that they wanted somebody local that they could see. I'm very fortunate. I have the lovely Dr. Paris that works with me, and she is absolutely obsessed with BHRT. She's really, she's such a good practitioner when it comes to kind of talking to patients about their hormone profile, assessing their bloods. And so she kind of leads that aspect for us. But it's opened another door to patients who were sort of on the edge of just not doing any HRT whatsoever. They felt that they weren't quite being listened to by their doctor, and they just wanted somebody to give them a real sort of overview of what's going on with their hormonal health. Because actually that's a huge part of it. It's actually the profile and really understanding very in depth what's happening with your bloods, your hormones, catering things, titrating them, checking things very frequently. There is absolutely nothing wrong with the HRT that is available on the NHS, and actually some of that is bioidentical as well. So it's about just being very careful about how you compound and approach that particular combination of hormones for that individual. What are they lacking? What are they missing? And catering it for them, and making sure that you address any symptoms that they might be experiencing.
I think it's in the same format that you address, the body and the sort of physical concerns of the patient. You have to be incredibly bespoke. You have to look at their, sort of background and what their body has been through and what their goals and objectives are. And it's the same with the hormones. It just needs to be sort of very carefully finessed so that you do give the most bespoke approach. And what I think is so great is that you've sort of wrapped this all up. It's all of these amazing services under one roof as well, which is really helpful for women who, like we were saying at the beginning of our chat, like have lost a bit of identity, a bit of self-confidence. They're quite overwhelmed and they don't really know where to go. So at least not having to then sort of shop around and go from pillar to post to address these myriad things. It's really nice to have it all under one roof.
Definitely, that's been my motto for such a long time, that I feel as though I want to be able to take care of every aspect of every patient that walks through the door. So having a complete sort of one-stop shop has just meant that patients feel very confident in us. They feel as though they don't have to keep repeating what they say, because we all understand exactly what they're going through. We can address so many different things, and I think it helps them to go on a journey with us. We're here to take care of them for the long term. This isn't the sort of situation where you've just had one small little procedure and then we never see you again. It's we would rather we stay in touch for the long term, and should anything else change, we can address that. There'll be other procedures that will come in that as time goes on, because somebody else will come up with a fantastic system or a new medical device that will address something else. And so we want to go on that journey with patients as well, and that's always been the case. We want to keep a one-stop shop system, if that makes sense.
Yeah, and I think you're so right. I think it's all about going on the journey with patients, and I think it's such a lovely way to approach it in the here and now. Thank you so much, Selena. It's been such a joy, as always, speaking with you. Thank you for giving up your evening. And anyone who's only just joined the Instagram Live, you can watch the full recording back on our IGTV. Selena's got some incredible treatments, devices, solutions for various midlife to menopausal stages and concerns. So you'll really want to listen to what she has to say. Thank you for joining us, everyone. Thank you again, Selena. And
thank you. Thank you.
Bye.